Early diagnosis and fast access to treatment is important when it comes to treating a heart condition. Circle Health Group, the UK's largest private hospital operator, uses innovative technology, non-invasive procedures, and works closely with their specialist consultants to provide a better and healthier future for their patients.
Jonathan had been living with a heart condition for 10 years before he opted for a private referral to the Circle Health Group, hoping for a longer-term solution.
I could feel my heartbeat. I could also feel when it stopped, because it kind of goes, stops for a bit, starts again, and it's all over the place, basically.
Must be worrying.
Yeah, it's concerning.
Jonathan's irregular heartbeat is caused by a condition called atrial fibrillation, or AF, affecting blood supply to the rest of the body.
My name is Dan, this is Jenna, so we'll be looking after you today.
Jonathan's been having a series of tests to see if advances in surgical technology can provide that more longer-term solution.
The fear of being in AF and the restrictions it has, I felt as though my life was restricted. Getting upstairs I'd be breathless and dizzy by the time I got to the top, or even before then. So that's a worry. You're just managing it. Whereas when I spoke with the cardiologist here at the Circle Group and got given an idea of what it could actually stop, it could actually be prevented, it could be dealt with, it's such a weight off, it's incredible.
And I think that's kind of where the journey began. And it's important, in my mind, usually just to break the heart down into very simple categories. One is the electrics of the heart, the second is the structure and function of the heart, and the third one is the perfusion or blood supply of the heart. And so pretty much most of these symptoms, you can find an abnormality in any of those three major categories. And it's a bit of detective work. And it involved quite a lot of testing, procedures such as a cardioversion, medical therapy, looking at him holistically, and then ultimately an ablation procedure.
Aaron. Right, we're just going to do the heart scan again. Right. All right.
Dr. Gary Wright is another of Circle Group's consultant cardiologists. Ronald had the same procedure as Jonathan 12 months ago. Today, he's back for a checkup, and it's good news.
Wonderful. Everything's pumping very nicely. Fibrillation treatment, in particular ablation, with the new cryoballoon approach, we find that it's quicker, it's easier, it's much better tolerated for patients. It means they can go home the same day, and it means that we can perform more procedures successfully in one day. It's a minimally invasive procedure that we do from the vein at the top of the leg. It's two little tubes that go in the vein. We place a couple of catheters inside the heart. There are 4 veins that drain blood from the lungs into that chamber, and it's within those veins there are sleeves of muscle that trigger off atrial fibrillation. And what we aim to do is freeze around the entrance of those veins. That in essence creates a scar tissue, and the scar tissue acts as a barrier for preventing AF getting back into the heart.
It's incumbent on Circle Health Group to really be at the forefront of evolving technology moving forward. We can deliver and tailor that technological advancement by working closely with our consultants. Our consultants are leaders in their field. They understand the possibilities, the technologies, the innovations which are present and also evolving and about to be there in the future. They can then guide us by working with us to make sure we're always at the cutting edge in terms of technology, innovation, to deliver what should be the best possible patient outcomes.
Circle's approach to early diagnostics and early interventions is giving people the confidence to embrace early screening, transforming the patient experience and helping them to live an active and fulfilling life.
This is an implantable loop recorder. So it's a heart rhythm monitoring device. It's implanted just under the skin to the left of the breastbone.
And that's what we can see sitting there.
And it has captured where the heart jumps from a normal rhythm to an abnormal rhythm, going from about 90 beats per minute in a normal rhythm to about 180 to 200 beats per minute in an abnormal rhythm.
But after surgery, that's something Jonathan no longer needs to worry about. How transformative has the surgery been?
It has transformed me from being fearful of doing pretty much anything, everyday stuff. As mentioned, walking up the stairs earlier, but walking the dog, riding a bike. She might not like this, but having intimate time with my wife, a bit scary, with a dicky heart. It's been a fabulous experience, really.